This is the second in a short series of video clips from the Adult Speech and Language Therapy Department in NHS Ayrshire and Arran. They are designed to support basic dysphagia care and are aimed at our whole community, including people living with dysphagia, their family, friends and carers, care home staff and other professionals. Ultimately, for anyone, and it will help you identify if someone has a problem. For further information on the importance of identifying and managing eating, drinking and swallowing difficulties in adults, please watch video 1. It's important that you know what signs and symptoms to look out for that can indicate that someone is having difficulty. If we were to say to you, how do you know that someone's having a problem? The first thing you might think of is that they are coughing and choking, perhaps with watery eyes, when eating or drinking. And you would be absolutely right. This coughing and choking can indicate that food or drink is going down the wrong way. There are, however, other signs and symptoms that you should look out for. We've already mentioned coughing and choking, but also be aware that throat clearing during or after eating or drinking may also indicate that there is difficulty. Other things to be aware of are pouching of food. This is often evident in the cheek, drooling of saliva, spillage of food or drink from the mouth, holding food or drink in the mouth, difficulty chewing, swallowing may appear slower and more effortful. There may be a sensation of food sticking in the throat. Some people may bring food back up, sometimes through the nose. Also, look out for a wet, gurgly voice during or after eating or drinking. Did you know that difficulty with breathing that develops while someone is eating and drinking can be a sign of swallowing difficulty? It can, and you should look out for the person struggling to breathe or rapid, shallow breathing. Repeated chest infections should not be ignored, as they can be another sign of difficulty swallowing. Over time, difficulty with swallowing may cause weight loss. There are a number of things that you should look out for. You may find that jewellery becomes ill-fitting, with rings and watches becoming looser. Clothing that fitted well becoming loose and baggy. Is that belt now needing to be tightened a notch? Or are you having to buy clothes in a smaller size? Loose, ill-fitting dentures can also be an indicator of weight loss. There may be feelings of weakness, tiredness and low energy levels. Loss of muscle mass and strength can also have an impact. Let's now think about eating. Some things to be aware of. A loss of appetite or a reluctance to eat or drink may be a sign that someone is starting to have problems with their swallowing. Also, sudden changes in eating habit. So, if someone has always enjoyed eating a roast chicken dinner, steak pie, a burger, or a nice juicy steak, but they are now choosing to eat or are asking for macaroni cheese, scrambled eggs, mince and tatties. This change may indicate that there is a difficulty, as they are now choosing foods that are easier to chew and swallow. After listening to this, you should now have a clearer understanding of what you should be looking out for and when to call speech and language therapy. If you live in Ayrshire and Arran, a referral can be made to speech and language therapy by phoning the relevant hub. You will see in front of you the numbers for East, North and South Ayrshire. Finally, look out for the third clip. It will provide information about how speech and language therapists can help.